Hey, everybody, and welcome to the 340B Ladies Lunch and Learn. We are so excited to have you all here. And this month we have special guests joining us from Cardinal, and they are Rachel Faulkner and Vicki Earhart, and they are going to be talking to us about all things DSCSA. We'll do a little bit more formal introduction of them in a second. But first, if you all would just introduce yourself in the chat, I'll bring up the slide deck. And so today in the chat, introduce yourself, your organization, entity type, also favorite comfort food. And for me, I don't know if I've mentioned it before, but I actually grew up in the Caribbean, and mine is a roti, which is a curry wrapped in a flatbread. And ladies, I don't know if I prepared you for this, but you probably saw it in the slide deck when it came over to you, but your favorite comfort foods. Vicki and Rachel.
So my favorite comfort food is probably, well, I had to go gluten-free, so it was a lot harder to do, but it's still probably gluten-free mac and cheese.
Solid choice.
I would say for me, I really love like a pot roast or with mashed potatoes, gravy, just kind of old school fashion.
Awesome. All right. And so, as I mentioned, we're going to be talking about DSCSA. And then just to do a little bit of an introduction, Rachel is a change lead for the DSCSA customer work stream. And so she's been on a road show for the last few months with Vicki, who's the director of account management key initiatives, both within Cardinal. I can have them tell you a little bit more about their roles, but they've been going across the country doing education as well as doing webinars on DSCSA. So we're really excited to have them here. They are definitely the experts in the room. I've been learning so much from them this month on the process. And then I will pass it over to you two. And then one quick poll before, as we get started, just to let us know who's in the room. Rebecca, if you wouldn't mind launching that. It's just the poll asking if you are from a covered entity type or if you are 340B friends and family. And that'll give you ladies an idea of who's in the room today.
All right.
Awesome. There's a lot of hospital and FQHCs. That's great. So awesome. Thank you, ladies, for joining us. Again, so I've been with Cardinal, just to give you a little bit of background. I've been with Cardinal about 31 years. Most recent, for the last several years, really just focusing on the customer, working with the account management team and sales team to make sure whatever initiatives, whether they're Cardinal initiatives or whether they are industry initiatives like this one, that our customers are prepared and ready to go for the initiative, and that we're doing the best that we can and hear our customers' needs. And then Rachel works with me, and I'll let her introduce herself.
Yeah, so I've worked with Cardinal Health over the last 13 years, various large initiatives from an organizational change management perspective. So again, in that same vein, partnering with Vicki and coming up with plans and approaches to prepare not only our customers, but also the sales teams that are supporting our customers for these big changes. So as we get started, have a quick poll just to kind of gauge your, when you hear DSCSA, what does it make you think of? What is there a phrase or a word that comes to mind? And we'll do a quick little word cloud to get us started, and just kind of, it's interesting when we do this to hear to see what are kind of in people's minds as it relates to this law.
And for me, I'm definitely thinking about tracking. So,
very good. I definitely heard that.
we've got chaos and confusion in the chat.
Okay.
Yep, that's very common. I think people have angst.
Mm-hmm.
Some are very concerned. So
we got some that say not ready and unknowns and more work.
Yep, I definitely a lot of extra hassle, stress. I can never get the letters in the right order. You're telling me. Long.
Why such a long acronym? I love that.
Totally. Well, good. If we go to the next slide.
And you all have the ability to control it too from the bottom.
That's right.
That's right. I
Just to
forgot.
remind you.
Thank you. Thank you for the reminder. So we are going to explore the following topics. What is DSCSA? We want to get a foundation because the law has been in effect for a while. And then what do we need to do to get prepared? So driving into how will this impact you and customers with these new provisions? Are you prepared? And where you can go for help. So we're going to go through this pretty quickly. Let's see, I'll go to the next one. So we'll start with what is DSCSA? I just turned off my camera. I'm sorry. I hit the wrong button.
So sorry, we're working under, we haven't worked with this webinar type tool before today, so bear with us a little bit.
So we have a timeline.
Oh, put you back on mute again.
That really shows the progression over the last 10 years. So one of the things that you'll notice is over that time period, there have been various big milestones. And what has happened, if you see in 2017, it would impact the manufacturers. Then a year later, it would impact the dispenser or the wholesalers and distributors, and then it would impact the dispensers. So in like 1 year with time increments. Well, now in 2023, the next set of provisions, the enhanced security provisions, getting down to that package level, all come into effect at the same time for all of us, manufacturers, wholesalers, and dispensers. And that's what has kind of, been that rush to, get us all ready all at the same time.
And Vicki, can I have you guys swap out whose mic's muted, because it's some of the people are in the audience are saying they're having difficulty hearing. So I'm not sure if we can swap back and forth. And just for everybody in the audience, they are, as I said, they're on a DSCSA roadshow, and so the challenge is that they're all in the same room.
Turned off the mic and
Turn on your mic.
Maybe.
All right. So I'm just going to probably talk through this, so that might be easier on everybody. So sorry about that. Can you hear me okay?
Yes.
Wonderful. I can hear you back. Okay. I'm like, sorry about yes, we're on a road show, so we're trying to figure out. So I apologize for the technical difficulties.
Okay.
So as Rachel was saying, as we were moving through this, previously, as the FDA rolled this out, it was more on a phased approach. With this coming into effect 2023, we all go live at the same time. And when I say all, I mean manufacturers, dispensers, and wholesalers. So, there's a lot to do in the next 2.5 months that we're down to, or I guess it's almost 3 months. I know I'm starting that little countdown clock because the days are just passing by quickly. But what's important about this is we do all go live at the same time. We do have to make sure that we are in accordance with the law, and what that means is that the transactional data is exchanged in a secure and interoperable electronic format at the unit level. And there's product tracing that needs to happen. So we'll go into this in more detail as we go on. Yeah, I need you to, I don't know where my button is.
I got it. I'll advance.
All right, you advance. So there, okay, there it is. Thanks. So Rachel's just going to sit here with me.
Perfect.
Okay, so receiving transaction data today, there are two ways that you can receive it, either through a web portal or through an ASN. So the web portal would be accessed via, we have our ordering platforms, we have links there. We also have links on our website. So depending on our customer, they may utilize it that way. So manufacturers and wholesalers are required to have some sort of portal for customers to be able to access the data. But some customers want to get the data directly, and so they can, in today's current state, they could use an EDI 856 advanced shipment notification and use a third-party provider to do that. And we have a couple examples there. So just a quick poll to get a sense for how do you access your data today? Are you aware? Are you not sure? Given that of the way the current law is written, you may not even be aware of how you access it because you haven't had to do it unless you have an audit or something like that, which isn't common. So majority of folks not sure how you would access that data. And that's what we're finding in our roadshows is that many people are not sure how they would get the data today, which is why, again, it's a bigger learning curve because I think from a law perspective, people think, oh, well, it's been around for everyone. Now we're just, taking it down to the package level. But in the reality, there's a lot of learning to happen. So if we go to the next one, how is this going to impact you?
So there's several ways as a dispenser this will impact you. As I stated before, the key changes that are coming in November is that all the data will be transmitted or via an interoperable data exchange. So that includes, the product number, which is a GTIN. So GTIN is the item number, the serial number, the lot, and the expiration date. So this will all be down at the package level, or AKA also down at the bottle level. So you can see a G10 for a total case. You can have a G10 and a serial number for a carton, and then it'll be down at the individual bottle level. Each customer also is required to have a global location number. So think of and we'll go into all of these in more detail, as well as, you will have to have the exception handling process, know how you're going to handle exceptions, have a verification of product process, and we'll go into those as well. And then also how product returns are affected back to manufacturers and back to wholesalers. So another poll question for you, which changes are you most interested in and want more information about? The interoperable data exchange, the global location number, the verification of product, exception handling, or product returns? So we'll wait for those answers to come in. And there's no better answer. It could be all of them. So, that's what we're here for, is to talk about all of them. But not surprised, as to where we are in the process, that the global location's coming up first because it's the first part of the process. You have to have a global location number to do business with us. And I know product returns also will be a little bit different and more to go into. First, let's talk about interoperable data exchange though. So there's two different ways that you will be able to get this data. One is through the web portal. And so if you deal with multiple wholesalers or deal with a lot of drop ship manufacturers that ship product directly from their site to you, you will have to go into each of our web portals to get access to the data when needed, especially like during an FDA or State Board of Pharmacy audit. So Cardinal offers that access for anything that we ship to you. So if we do provide like a drop ship financial transaction for you, that information and that serialization data will not be in our portal. That will be in the manufacturer's portal. So that will be very important to remember, that you might have to go to multiple portals in case of an audit or in case of if there's any product that you expect has issues. Sorry. And then the second way, it's not actually the accept and handling process. It's actually if you want to receive an EPCS third-party provider. What third-party providers do is be able to consolidate all that data for you in one place. So if you're buying from multiple places, you might want to look into an EPCIS third-party provider. And what EPCS means is electronic product code information services. So what that does is kind of think of it like it just consolidates everything for you. There are fees to that, and we'll go into a little bit more of that. And it depends on it depends on who you pick. But this option replaces all the TI, TH, and TS that is in the current ASN. The ASN no longer will be a DSCSA compliant document. So even though you might use an ASN in order for receiving, it will no longer be a compliant document. So to kind of go into more detail of just what the web portal, like what the reports will look like, this is a draft of what it looks like. It's still in development. We will have more webinars, by the way, as we go on this journey that we could be invited back to if you guys feel like it and you guys want more information. But as this is in development, we'll be having a webinar. We have webinars in October that you can see more of how this will work on the Cardinal Health portal. We don't have examples of every other wholesalers portal, but as you can see, hopefully I know it's a little bit small, but there's serial number, expiration date, and lot number for each item. You can see you're sold to, who it was sold to, where it was shipped from, and then who it was shipped to as well.
And one of the things that I've noticed at this point is that a lot of the wholesalers are actually putting the GLNs on the invoices already, which can be really helpful and to identify, do you need to go out on your own and look for them? So that's something that you had on that visibility as well in that last slide.
Yep. Yes. As we talk about GLNs here coming up, there's multiple ways that if you are a Cardinal customer that you can get your GLN. But if you are interested, so if you're interested in using the portal, you're not going to use EPCIS. There's no sign up. If you have an Order Express or web link sign on, you would automatically get to the portal through there. But if you are interested in EPCS, there are some things that you should know. Like I stated before, there's the data consolidation aspect. Again, if you're buying from multiple wholesalers, it might be the way that you want to go. There is a cost to doing that. Each EPCS third-party solution provider has different costs. They have different bells and whistles. So we're not going to recommend to you who you should use. It depends, of course, of your budget, of your processes, and what best fits your business need. And then also there are multiple providers that are offering. I think we're about up to 10. So if you actually are interested, you just go Google it, go type in EPCS third-party solution provider, and there are a list of software vendors that are providing that. Cardinal Health is working with Antares Vision Group, also known as RFXL, as our third-party provider. So if you do decide to go the EPCS route, what will happen is we will need to onboard you. So even though you onboard with that third-party provider, you also need to onboard with us so that we have the okay to send the data to them. So this QR code here is actually so you can start the onboarding process. If your organization does want to use EPCIS, try to get that to us as soon as possible if you are. Reason being, it is taking time to onboard, and we want to make sure that we onboard everybody properly before 11/27. So next polling question. Have you decided how you'll access or receive your DSCSA serialized transaction after 11/27? Will you just receive it through the wholesale web portal? Will you use an EPCS provider, or are you still deciding? So it looks like we have a good mixture. Most people probably using the web portal, but I know a lot are still deciding. So I would, really work with your decision makers on, what your organization wants to do so that you'll be able to meet the requirement of the law. And we'll go into more of what that requirement is here shortly. Biggest thing though out of the gate is if we do not have a GLN for you yet, and you have less than 9 sites, We do need to have a global location number in our system for you in order to distribute pharmaceuticals to you come 11/27. This is not just a Cardinal requirement. The other wholesalers are asking for the same thing. That this GLN must be assigned to you. So if you think of a GLN, you don't need to have a separate GLN per wholesaler or manufacturer. It's one GLN. It's kind of like a DEA number, but it's a global location number. Just like you can use the same DEA number anywhere, you use the same global location number anywhere, or you think of it as your social security number. So, if it's your site, if you move your site, you will have to create a new GLN. So it is by location. So it's very unique, and you do need one for a sold to and a ship to. If you are the same organization and your sold to and ship to is the same, then it can be the same GLN. But if you have a different corporate location that maybe possibly you have a sold to, then that sold to number would be different than the ship to that we're shipping merchandise to. It's very important that if we do, like I said, have those and what is needed to do that. So with that, do you want to talk about verification of product?
Sure. So from a verification of product, this is where determining whether the product identifier, that 2D barcode affixed to the package, corresponds to the NDC, lot number, expiration, all of that. So under the law, you're not required to scan every single product that comes in. However, if there is an investigation of illegitimate or suspect product, then you do have responsibility to verify the lot number and the product identifier for at least 3 packages or 10% of the suspect product. So again, this is where encouraging you to get processes in place for managing and how you're going to respond, how you're going to get that data, right? That's where the last topic comes into play. You're going to use the portal, or you're going to use the EPCIS solution provider to get the data in the event of a suspect product or investigation. We want to talk about exception handling processes. And so with all of the serialized data down to the product level, there are going to be some errors. That's the reality. It's complex, and it's going to require more time for us to resolve the data discrepancies. And this is across the supply chain. So the reconciliation of the product, the data, so you're expected to reconcile. You don't need to scan every single item, but there is that, ensuring that you are getting the serialized data, and that your product does have the 2D barcodes and all of that good stuff. The common types of exceptions that we expect to see are that you might receive product, but you didn't receive the transaction data that goes along with that. So that's a problem. Or you received the data, but you don't have the product. So maybe you ordered 5, but we sent you only 4. So there is going to be some of that in exception handling. So processes that we're going to be developing, and you'll need to follow in order to resolve these issues and get the transaction data lined up. So with regards to overages and shortages, customers will need, from a Cardinal Health perspective, to return all free goods. So if we send you an overage, in the past you may have been able to keep that, but because over a short period of time we need to reconcile that data, we need to have customers return that product. So as far as shortages and overages, you're going to be required to provide that serial number. So it's on the product, but you're also going to need to make sure that the transaction data that you've received matches up with the product that you also received. So from a product returns perspective.
Yep. So product returns. So what's very important about this is that we can only take returns back for product that we sold to you. So it has to be what is called sellable inventory. So with that, we are now going to be requesting in return, when you do a return, the serial number of the product that you are returning and sometimes the global trade item number, or the GTIN. So if you're returning a case, we're going to need to know what that GTIN is with that serial number. If you're returning just an each, which is our lowest unit of measure, you just need the serial number. So that will be required in order for an MRA to be issued to you. So if you go to return a serial number and you have multiple wholesalers and you don't know where you bought it from, if you are using Order Express or WebLink or calling into customer service, you can type or scan that in. And then it will either deny the credit, deny the product for return, and you might have to go to a different wholesaler or manufacturer to return the item. One very important thing to remember here is you have to do the return under the account that you purchased from. So for the 340B implications there is, if you are a 340B contracting entity, you have a WAC account and a 340B account and a GPO account, you need to make sure that you are returning that serialized item under the account that you purchased on. So going back to the portal, and why you might want to use the portal, why you want to use an EPCS third-party provider, you can go in, look at that data there, figure out what account you purchased it from, if it's not on the sticker. I'm not sure if you all use stickers or not. And then you can easily be able to return that item based off of that. So very important there to remember. One thing, actually, before I go on to this page, one thing that's very important on returns too that will let you know is, if you do use Order Express, there will be a mobile scanning option through the mobile app that we will have available by November. That, especially if you do a lot of returns, you might really want to invest. The mobile app doesn't cost you anything. You can have a phone. We also have a handheld that we will be able to lease to you, but the cheapest version is like using your phone or just buying an old iPhone. That might be maybe not the current one, but maybe a year or two old. Buying one for your organization, use the mobile app in order for that, and it's much easier to do a lot of scanning, because if you think about it, when you start typing in all those serial numbers, that's a lot of typing. You can transpose items and it'll come back rejected, and it's probably a little bit aggravating. So we are working on a tethered scanner option, but that won't be available into first quarter of 24. And then to kind of just, kind of go through, like, how are we supporting you all to get ready? We are enumerating GLNs for any customer that has less than 9 location. So I did miss out. I think we cut that slide but yes, basically for GLNs, there's 2 places that you can get your GLN. One, the biggest way is go into Order Express and download a PDF of one of your invoices. Or if you get a paper invoice, the GLN is there too. It's the ship to address with the ship to GLN, and the sold to bill to address with the bill to GLN underneath it. And then, so we're getting ready for that. We're about 70%. So if you have more than 9 locations and you haven't given us your GLN yet, please do, so that we can make sure we can ship you product on 11/27. So get those over to us as soon as possible so we can get those uploaded into our system so the data matches. And then, of course, we're updating our web portal reports that we went through a little bit to make sure it has the required information. We're working with third-party solution providers to get you all set up and onboarded with EPCIS connections. And then, of course, we're updating the OE mobile app to enable scanning.
All right, so that covers all the major impacts, just really trying to distill it down. So are you prepared? Well, here's 5 actions based on those changes that you can take to ensure a smooth transition. So the first one is knowing your GLN. So we've talked about that. So working with your wholesaler, if you're with Cardinal Health, we have multiple ways to get that information to you, but that's first and foremost. You're not going to go much further in the process until you get the GLN. The second one is decide how you're going to receive the data. So we talked about that. You can use a web portal. That's the easiest way. There's no additional cost. you'll have your GLN, you'll be able to access the data and be compliant. But you can also, if you want to have more easily accessible to your data, if you're using multiple providers, you may want to use a third-party EPCIS provider. Establish processes for investigations for suspect products. So that's something that, you know, you're going to want to be prepared and have your organization prepared in the event that there is, you know, a suspect product, and know how you're going to get that data, where your data is, and train your staff in order to do that. The whole reason why we're doing this is to ensure a safer supply chain. And then assess your need for a third-party provider. So we talked about deciding what you're going to use, but really, do you really need that? How does your, you know, what are your requirements as far as an organization? And is it worth the extra cost to go to an EPCIS third-party provider? The last one is understanding the product returns. So we talked about that. That is going to be, you know, next to global location numbers, returns process is going to be the biggest change. And so understanding what those processes are going to look like for with your wholesaler. We will be having a webinar coming up later as we get closer to cover returns, because, you know, we've just touched on it and we know there's going to be a lot more questions and more how to, like, what do you specifically need to do differently? So we'll also be helping with that. So where can you go for help? So from a, I'm not sure where that popped up. Sorry. There is the FDA website. So you may want to go and review the law and see from a dispenser perspective how, you know, how you're impacted. We've tried to distill it down, but sorry, we just had something. Looks like
That's good.
And then we have the resource center. So from a Cardinal Health perspective, it looks like some folks are already going out there and clicking on it, and that's great. You know, this is where, as we go along this journey and our path to November 27th, we're adding key terms, frequently asked questions, customer communications each month, and webinars. So we have a webinar on global location numbers. If you really want to dive deep on that, you could refer back to that. We partnered with GS1, which is the standards organization, back in May. So that could be something, if you're still working on the GLN component and want to get that right, you can go a deeper dive on that. We also have our last webinar, very similar to what we've done here, but for Cardinal Health employees, we did a webinar last week. So lots of good stuff there. In the event you have questions, we have a GMB, DSCSA info at cardinalhealth.com that you can reference as well. And then, all right. So how ready are you for November and these provisions? Let's see. Ooh. Not ready, but getting there. Not ready at all.
Still trying to process.
Yeah.
So to be fair, so I was at our retail business conference back in July now, and so this, you know, the class of traded here, the 340B team, you're not any different than the retail independents. A lot of people are not prepared yet and not ready, and that's why we're here, is to try to get everybody more ready. Make sure that we're giving you, you know, the DSCSA Resource Center that you can go out and read. You know, I highly recommend going out to our internet site and that resource center to get more information. So it really is helpful and has done. And I even go out there, like, even though I've been doing this for a while now, and it's just like, oh, let me see how we want to, like, talk about that, or how we, like, it's been very helpful and very useful to prepare all of us in order to get ready. You know, so, you know, feel free to reach out to us at all at DSCSA info too if you have any questions. But with that, I think we can probably turn it over to Q&A.
Yeah, and so we have quite a few questions that have come in from different members of the audience. So I'm just going to run through some of them. So one of them is about returns, and you all touched on it a little bit, but I think it would be great to go into some more detail. And so the question is about a practice that we've commonly seen historically. So contract pharmacies tends to be smaller independents, right? They receive a medication in their 340B shipment. They already have a bottle on the shelf. Now they go to return it on their own retail account. Can you talk about what that would look like in this new state, right? Is that possible?
No, so retail accounts will have to return on their retail account, and 340B accounts will have to return on their 340B account. So if they do something like credit replenishment through Cardinal Health, then basically what's going to happen is you'll no longer be able to return that product through the credit replenishment program. So what I've been recommending to retail independent pharmacies is do not move that product over to the contract or even anyone, like, so if you have a retail pharmacy and a 340B, and you do credit replenishment, do not move it over to the 340B account until you know the patient is going to pick it up, or until you know it's patient need, because it will no longer be returnable. You have to return it on your account that you purchased it from.
And then just looking at the question to make sure, and so there's another sort of variance on it. If you're trying to correct 340B accumulations, negative or over purchasing, and purchase on the non-340B account and return on the 340B account, talking about credit rebilling. So it sounds like in the scenario that's going on here, the better thing to do would be to work with the wholesaler on a formal credit rebill request.
Well, that actually, it actually, I think, goes back to the same thing. It sounds like it's a credit replenishment.
Mm-hmm.
So we will not be able to do a return on that any longer.
No, and in the case where a covered entity bought it on the wrong, if you bought it on the wrong account, then you could.
Yeah, if you bought it on the wrong account,
you could just return it on the right account and purchase it on the other, or you could request a credit rebill.
Yep.
And then there's one that is about the GLNs at the contract pharmacy, and this one is essentially getting to that the covered entities do not need to obtain a GLN for their contract pharmacies, because each pharmacy is going to have their own individual. That
is correct.
Any other pieces that we need to add to that?
Nope, that is correct. So for the retail pharmacies, even though they have a different sold to, because as a contracting entity, we just need the sold to for that account. We do not need the ship to. We have the ship to. So we either have the ship tos via, mirroring accounts, or just going out into the GS1 and getting them for you. So the retail pharmacies, you do not need to provide those GLNs. We have those.
Great. And then another question, this one's from Chelsea, and she wants to know, will credit rebills still be an option with DSCSA regulations?
Yes, credit and rebills will be.
And they're probably going to be something we use more often.
Yeah, we still have pricing issues. The pricing issues don't, unfortunately, magically go away. I know we all wish they would. But, with GPOs and so forth, we'll still be able to issue credit and rebills.
And I've got a great question from Hannah. And so big kudos to Hannah. They went through the process and enumerated a few GLNs. And one of the things that they found out in doing that process was that there were duplicates for one of their addresses. And so she's looking for tips for removing unused GLNs. And then the other piece that I would add to that is if you have any tips for identifying if there's already a GLN in place so that people don't duplicate.
Yep. So two things. The first one, if you do have a duplicate GLN, realized is some of the GPOs, or even, some of us wholesalers, went and couldn't find your GLN. Maybe the address was spelled a little bit different, or the name was spelled a little bit different, and we might have accidentally enumerated one for you, or we've enumerated one for you. You didn't realize it was out there. You did it yourself. Just if it's a Cardinal account, reach out to DSCSA info@cardinalhealth.com and tell us what GLN you no longer want. We will work with GS1 to get that account deleted or AKA canceled. I would think that the other wholesalers probably have the same process. If you are, an ABC or McKesson customer, just, work with your wholesaler on that to try to get those deleted. And then if you're wondering if you have a GLN, I know for Cardinal Health, just, go to your invoice, see if the GLN is there underneath your ship to or sold to address, or also go out to GS1 and you can do a search by your name or your pharmacy. Sometimes even, even look at state, look at all pharmacies in the city and state that you're located. Because again, due to spelling mistakes and, some people might put in West Main Street, others might be W Main ST. That will, it'll come up different. So look for your name, look at city and state if you don't see it on our invoice.
Perfect. All right, let's see. Looking at other questions. This one is a very long one. Katie, I'm trying to quickly get through it. It's talking about the regular returns that are being processed on the accounts, and talking about pharmacies purchasing and then using that return process. And then would you talk about both Cardinal and AmerisourceBergen have a wonderful system in place that I don't see adopted as much as I would like to, which is the virtual replenishment, where it looks back at previous purchases on the retail accounts and uses that for the 340B accounts. Are you familiar with that, ladies?
I am not.
Okay,
But if you
I will
go
share about that then. So both Cardinal and AmerisourceBergen have a credit-based replenishment model that you can set up on your 340B contract pharmacy accounts. And the nice thing about that is that you're not actually receiving a physical product, that the retail account of the pharmacy gets credited, and then you as the 340B covered entity gets charged. And it keeps the information, the serialized information stays consistent across both, but it doesn't result in over replenishing the pharmacy. So it eliminates that need for the pharmacy to do all of these returns. And so if you're Cardinal or an Amerisource client and you have pharmacies that are doing returns, highly encourage you to put that account setup on your contracts.
So one thing I will say with the credit replenishment program, definitely agree. What happens though is when that product moves to the contracting pharmacy, the serialization data does not go with it. So it's actually just a financial transaction. And the reason why the sterilization information doesn't go with it to that account is we don't know exactly what bottle you're moving. So we can't, you have 5 bottles. Say you use multiple wholesalers. Not that anyone does that. I know people do. So let's say you bought 3 different amoxicillins from 3 different suppliers. Okay. And even though you do credit replenishment with us for the contracting facility, it's still a financial transaction, not a serialization transaction, because we don't know which one you're moving. So if you didn't purchase that from us to begin with, we don't know what serial number you're moving to that other account to be able to provide that transactional data. So, you could have dispensed a product that you purchased from ABC versus what you purchased from us. So we can't have that transactional data go with us. So that's why we can't, if once you do that credit replenishment, that item is no longer returnable to Cardinal Health.
Yes. But the assumption would be that they shouldn't need to return it because they've received an item that they already got. So they should have less inventory swell. So it should offset some of those challenges.
Agree.
And just looking at other questions that we've got that are coming in here. Yeah, Allison is talking about the credit-based replenishment too. And okay, we've got one that says we supply medications to rural health clinic owned by a hospital. Will they need a separate GLN? And will we need to track the medications that we send them? And Kathy, I would like to know, are you a pharmacy? We have different locations, but we're both part of the same hospital. So I'll let you ladies talk about this because this does fall into the exceptions.
Yep. So if you are selling product or if you're transferring product to another clinic or another physician's office or hospital that is owned by the same organization, then you do not need to provide the transactional data or the EPCIS data. If you are selling to pharmacies or other clinics or hospitals that are not owned by the same owner, you are required by law to provide that transactional data unless it's for direct urgent customer need. So if they're going to buy it from you because you have overstock and they need the stock, but there's no direct patient need at the time, you are required to provide the EPCIS data that goes or that transactional data that goes with that product. So you would have to set up like an AS2 connection in order to do that. Does that answer I think that answers the question.
Yes, perfect.
Okay.
And I'm looking to see if there are other questions. And Katie, if you are at McKesson, I would be happy to connect with you as well and talk more about it because it's a fantastic offering that we would love to see you all have. Did anybody have questions in the chat that I missed? I'm doing my best to read through them and see if there are any others that we've missed. But are there any questions that are burning that we haven't addressed? If yes, please feel free to drop them in. We've also got a summary on DSCSA. It's pretty rough, but it is it tries to address across multiple wholesalers and contacts across the different wholesalers of where to go. And then also just remember, take a peek at your invoices to see if you do have a GLN already assigned. Gives you a great idea of where you need to go next. Your big checkbox right now is making sure you have those GLNs so that you can continue to get medications. Vicki and Rachel, any last words for this section before we jump into the next portion where we're just going to talk about a few hot topics? Now, I appreciate this so that you've joined us so much, and we will definitely love to have you come back and teach us more as this all evolves. It is it's definitely overwhelming. There is a question about borrow and return process between the hospital pharmacies. And if you, in the document that we just put in as for the summary, the very last page has a list of what the exceptions are. And so likely some of those pieces will fall under the exception process as far as, you know, if you're borrowing for an emergency situation and it's a small amount of product or moving things within the same organization. And then there was a question about the implications of clinic administered drugs. Is this exempt? Again, you'll see there's some information in that summary that talks about that too, but no, because it talks about pharmacies as far as dispensing, but also those who administer medications. Vicki, Rachel, if you want to chime in on that one a little bit more. So the clinic locations that are dispensing medications or administering medications to patients will also need GLNs?
Yes. Any dispenser needs a GLN because we have to be able to send you that transactional data. So I did think I saw a question that one wholesaler said we do not need a GLN for our bill to. since they do not receive actual product. There has to be a sold to and a shipped to GLN because it's really the sold to that owns the product. So hopefully, I would get one if I were you. I'm just saying, we are totally that you need to have a sold to and a shipped to GLN.
Awesome. All right. In the last couple minutes, we'll just run through some of the hot topics. And ladies, I know you mentioned that you may have to drop off shortly before we finish, but thank you so much for being here and thank you for all of this wonderful information. Just changing gears, we're going to start just a quick update on what has changed since the last time we talked. And so we have two manufacturers that have actually lightened their contract pharmacy restrictions. And so there is concessions that have been made by Merck for the state of Arkansas and by Teva for Arkansas and Louisiana. And what they have done is they have actually reopened access to their medications for contract pharmacies when submitting data. And the reason for that is the state laws that have been put in place. And so Arkansas being the first state law that was passed back in 2021, they have been involved in lawsuits with pharma that are currently in an appeal case right now. But what has happened is that Arkansas was successful in their first case, which is why farmers appealed it. Louisiana wrote a law that is very similar to Arkansas's, except for they have added some additional strength to the enforcement side of it. So where Arkansas's enforcement relies on the insurance board side of the state, Louisiana's actually has the ability for the Attorney General of the state to be involved as well. And so there are now a few other states that are looking at following suit. And given that we are seeing positive movement based on these state laws, that makes sense. And since we spoke last month, we have also seen that HRSA has filed a brief in the Genesis lawsuit. So the Genesis lawsuit has been going on for a few years now. They originally had a HRSA audit where they had findings of both diversion and lack of auditable records. HRSA originally gave them findings that resulted in them being put out of the 340B program. Genesis sued, and HRSA, prior to the lawsuit actually going forward, HRSA avoided the audit, and then the original lawsuit was ruled in the favor of HRSA. And Genesis filed an appeal. This is the case that we're in right now. And the appeal has been sent back down to a lower court to make a ruling. And essentially, the higher court found that Genesis could potentially have harm because HRSA could audit them again and have similar findings. And what's happened is HRSA has put in their brief. They have a lot of really administrative and sort of technical reasons why they do not believe that Genesis has grounds for findings in their favor, having to do with the fact that Genesis did not make their arguments that they are making now in this case back during the audit, as well as some other procedural things having to do with the administrative process. And since HRSA put in their filing, we've also had 5 manufacturers who have filed amicus briefs and or what they call friend of the court briefs, and suggesting that HRSA has authority to administer the 340B program via guidance. And so it's really interesting because at the core of what Genesis is disputing is HRSA's authority to define patient, which HRSA did in their 1996 guidance. And in other lawsuits that continue to be ongoing, the pharmaceutical manufacturers are defying HRSA's authority around contract pharmacy. However, they have come to HRSA's defense here and said, yes, HRSA does have the authority to define patient, and that they would like the court to rule in HRSA's favor and essentially not in Genesis's. So very interesting. And I'm curious about how these amicus brief will come back in the other lawsuits as we go forward with those on the contract pharmacy side, because this is the definition of having your cake and eating it too. If you can say HRSA has authority for one guidance, but not authority for others. So very interesting. And just in the last few minutes, there was an article in the 340B report, if you are readers or subscribers to that, that had a very sensational headline. And it talked about programs or covered entities being terminated from the 340B program. And that was a misrepresented headline. The terminations that were occurred from the audits that have come back so far for 2023 were around contract pharmacies, whether it was ones that didn't have contracts and agreements in place, or some were duplicate contract pharmacy registrations, which would be appropriate for the duplicated registration to be terminated. So just want to put that out there. No covered entities have been terminated from the program this year based on HRSA audits. And so this chart is a review of audits year over year. Caveat being 2023, we only have a small portion of our audits back so far. So it's only about a third of them. So this is not necessarily reflective of where we will end with our final numbers. So it may be one of the reasons why our critical access hospitals look so high compared to previous years and the percentage of audits that are being conducted. So this is just based on entity type. And fun fact, I had to look this up because CHC is what we typically refer to as federally qualified health centers. FQHC lookalikes, that one's obvious, but this FQHC is actually the FQHC Indian Health Centers. So just giving you an idea of where we are and the breakdown of hospitals versus grantees for this year. And then as we go into the program and looking at no sanctions as the top line, so those who are of those audited who came back with no findings. So the greatest portion of covered entities reviewed had no findings. There were a number of them that had potential manufacturer repayments listed. However, just the termination from the 340B program, as mentioned, was related to contract pharmacy and the contract pharmacy registrations. And so this is just a summary of sanctions. And so for the most part, it's the potential for manufacturer repayment. And then this chart is looking at year over year. So pink being this year, the darker blue being 2022, the light blue being 2021. And so what we're seeing is we have had no findings of diversion this year, but what we have had is a lot of our findings centering around OPACE registrations and the duplicate discounts. For the most part, those results, until they do their full assessments, these ones are subject to change. But for the most part, there was only one that had a confirmed billing issue during the audit, and the majority were actually inaccuracies in the Medicaid exclusion file. And so on the OPACE registrations, they centered around Medicare cost reports, around how covered entity locations were listed. So if you're an FQHC, it's your FQHC site to your EHB. And then also authorizing official and primary contact, making sure that information is listed correctly. And one of the things the HRSA auditors love to do is actually call you during the HRSA audit and make sure that that phone number works. So these are places really what I consider, your easy points on the test, making sure that your OPACE database and your Medicaid exclusion file are up to date and accurate. Those are items that you can be on top of, and it's much more controllable than many of the other places in our 340B program. So be in your OPACE database consistently and keep an eye on that, because those are where we're really seeing program findings right now. And so this is just a little bit of a deeper dive, really where we're seeing those OPACE findings. So again, Medicare cost reports. One of the nice features that HRSA introduced this year is that they are essentially prompting you to update your cost report information. So previously there was no prompt to go and to do this, and there was no way to update your cost report outside of cycle for when you did your recertification. Now you are able to do that through change request. And when you go in to do your recertification, if you haven't updated this information, it actually prompts you to do so. So that was very nice of HRSA, and I would anticipate based on that, we should see this the OPACE inaccuracies for Medicare cost reports to go down year over year. So upcoming, I will be at these, our team will be at these. So if you are going to be attending any of these events, looking forward to seeing you at CHI and 340B Day, at the Grand T Conference in St. Louis, and then also at the Midwest Regional Conference in Ohio. So everybody, thank you so much. And here are our upcoming sessions. And we look forward to seeing everybody next month, and really appreciate you all being here.